So first, tell us a little bit about how you got into gynecologic surgery.
Well, actually, my dad's a general surgeon, so I got into gynecologic surgery because I really got too sick during pediatrics. So I went to med thinking I would really be great in peds, and I knew some pediatricians and admired them, including our own family doc. And then when I did the rotation, I literally was sick like all 2 months. I was like, I don't think I could do this. And then you had to deal with the parents. So I said, I want to do surgery. And then I, did research at Hopkins in plastic surgery. I worked on the trauma team. And then I just thought it was too, a little bit too crass for me. I mean, we would all be carrying the trauma pagers and then stay in the same call room, which at the time was a thing. It was like multiple bunks, and it was just a little bit too misogynistic. Honestly, I want to say, we just did this big sexual harassment. There was a lot of harassment. Let's just be honest with it back then. And this is the 1990s or late 80s. So then I said, I'll do OBGYN. And then I did OBGYN and I did OB for the first month. And it was just a little bit crazy with a lot of fluids, a lot of smells. I told my dad, I think I made the wrong choice. And I think maybe I'll just go back into surgery. And this was at the University of Florida. And then and it came out, I think it was it was probably contemporary OBGYN, an article came out with Linda's picture talking about urogynecology. And my chair, who was a REI guy, and he's actually a member of SGS, told me about SGS, told me about OGS. OGS would have this newsletter that was red, white, and blue. I mean, it was literally mailed every bi-monthly or something. And he would give me these things. And, there is this society, and then there is this Society for Gynecologic Surgeons. And there was a lot of people at University of Florida who were, famous surgeons and members. And so I said, well, this is interesting. And then that article came out about urogynecology. And at the time, I mean, there were only 9 programs. I mean, this is 1991. In the world, 6 in America, like maybe 2 in Canada, and then Stu Stanton's. And I said, well, let me just look into it. And long story short, we interviewed. There was no match. I interviewed with several programs, and then Linda just called me. How'd you like to come to Chicago? And then the rest is history. But I think that just came at the right time. Things just happen. I didn't know anything about it. The society was very, very young at the time. And then the Society of Urogyn Society was young, and Society of Gynecologic Surgeons, there were very few women initially. So I don't know. I got into it, and I haven't been able to look back. I just feel very indebted to the society because I've had a lot of people who basically just open doors for my career, and it is my obligation to do the same for the people that I know and mentor.
Well, I mean, I think you're top of list when people talk about their mentors and sponsors, especially since talking about that junior cohort I was just mentioning at OGS being very young. I think you're top of list for a lot of those individuals.
I write a lot of letters, and I don't use Chat GPT, although maybe I take I take those letters of recommendations really, really seriously. I actually have to meet with people, whether it be a student, a resident want to go into fellowship, fellows want to go into jobs, and doing even promotions, for people who want to get academic promotions. I take that all very seriously because I felt like a lot of doors were open for me. And that is part of our, we have to do that. I mean, we just have to do that to pass the baton, making sure we're just helping the best and the brightest achieve all of their personal goals. Because, without the kinds of people that did that stuff for me, Mark Walters, just even recommending me to be on the GYM practice committee, obviously Dee Fenner, obviously Linda Brubaker, who is like a uber mentor for me. I was very lucky.
Well, there's like luck and also sort of the way you present yourself, and if
Mhm.
people believe in you and think you're going to be extensions of them, right? That luck is only part of it too. So you've mentioned your mentors and sponsors. Anybody else you sort of wanted to give a shout out to?
I want to give a shout out to all of my partners. We literally have celebrated our 25th anniversary. So I started this program in 1999 with me and myself and I. Initially, we had a nurse practitioner initially, and I remember it was like a $600,000 investment to open the terrible word, Washington Continent Center. Terrible, terrible name. And then we changed it to the Washington Institute for Pelvic Medicine and Surgery. Equally terrible because the acronym looks like wimps. But anyway, now it's a National Center for Advanced Pelvic Surgery. And, I have partners that have been with me for 2 decades and have literally we have built this program to the powerhouse that it is with the 31 fellows that we have graduated with an intermix of um, both Urogyn and MIGS. That's somewhat unique, including urology, all in here, and have canvassed the whole DMV area. I mean, it is quite an operation in the District of Columbia, Maryland, and Virginia, and even Baltimore, like north north of the city. So I think that's great, and our fellows are getting such good training. I mean, I feel like all of my partners have taught me a lot. I remember doing my first, as I said in my speech at SGS, over 70% of what I do now, I never learned in fellowship, although I learned the principles and we learned how to learn how to do surgery and obviously the basis of anatomy and dissection and stuff and relationships and seeing planes. But newer things, like I remember doing the first robotic sacrocolpopexy with Andy Sokol because he had learned it under Fifi. And Barry and everybody over there at Cleveland Clinic, and things that Rob Gutman has taught me, particularly with a lot of the fistula stuff that he has done, and grafts and hysteropexies, because that was not a thing when I was training. And we did open colpopexies with Gore-Tex. Obviously, being able to learn from mistakes and um, assess these new technologies. I do think that is something that I'm interested in, has led to some of my involvement with some things at the FDA. But I like looking at these new inventions. I like and innovations and seeing where they fit in our own toolbox and how they can help women. But the field is just changed tremendously from when I first did my fellowship, back in 1995. But I think without societies like the Society for Gynecologic Surgeons and partnering with our industry partners, I just don't think I would, be in the position that I am today without a lot of these people.
To you, what makes a good gynecologic surgeon?
Oh, what makes a good gynecologic surgeon? Uh, I would say I don't know how you can quantify it, but there's a judgment factor in there. There is a decision to take someone to surgery and to be able to, um, make that right kind of decision that's shared with the patient without being overly promising. And yeah, as they say, over promise, under deliver. I mean, I always think of those three things about the affable, available, obviously able, but there is a part of gynecologic surgery that needs a lot of sensitivity with the stuff, with the kind of things that we do. I think a lot different from other surgical specialties where, survival, blah, blah, blah. We really, in particularly in urogyn, deal a lot with a quality of life and the function. And I think that has to be emphasized in the kind of work that we do as reconstructive pelvic surgeons.
So this upcoming meeting, the theme is surgeons as change agents. So I was wondering what that might mean to you, and what changes you've seen evolve in GYN surgery in your career, and what you think might be next.
Oh, you know, okay, so there's some happy and then there's some sad for our field. The happy is that we are just doing so much different technological things that we're have much better patient outcomes. Whereas, as I said, I trained doing rectus fascia slings, hundreds of those, and sacred copopexies um, as a fellow, and now they're rare. But the sacred copopexies are all open, and now doing all of this minimally invasively, the addition of the robot, the ergonomic aspects, V notes to whatever degree in terms of visualization to add to the. I do think that things are getting better, and I think you can get fewer complications. The sad part of gynecologic surgery, where we are going to need some agents of change, is that with the way reimbursements are right now, I'm concerned about our specialty being almost crowded out by other specialties that have better reimbursements and remuneration. And I don't like that. So I think, as you see in my little tagline, it's Cheryl B, MD, FACOG, FACS. As many have said, we need to band together and just kind of understand how some of these RVUs are allocated, at the RUC here in Washington through the AMA, getting involved, just so that people can understand that it takes a lot of training to do the kind of work that we do in the best way fashion and the right thing for the patients. And just because we're making it kind of easier to recover, I feel like we're almost being punished for doing the right thing in terms of reimbursements. Now, I'll be happy again in that obviously I think the majority of us who are in academic medicine, and certainly who are members of the Society for Gynecologic Surgeons, don't do everything for money. We do it because we're passionate about it. We do it because we love it. We do it because we like to pass the baton to our next generation of advanced pelvic surgeons. And, gratefully, I'm in that category, but there are economic forces and practicality for, whether it be, allocation of block time, your ability to expand and get APPs and be able to, get your patient seen and treated in a timely fashion. All of that matters, and yeah, the economics are a little bit concerning to me. It worries me a bit, particularly when I see, and this again is a little bit sad, when I see people who are getting contracts that like similar to what I had 30 years ago. I think that that's almost a slap in the face, considering, all the training and the debt and sacrifices that people have made to do this. And I don't know of any other industry that has not kept up with the cost of living.
It's so funny you brought this up. I had a mentorship meeting this morning with one of my residents that I still meet with quarterly, who's a second-year fellow right now, about choosing a job and a job contract. And to follow that, I had a division meeting with my group, and we were talking about, we're a mixed urology GYN group, but still our urologists, there's inequity between us within our groups. They have more block time, they have more APP support, and the GYNs have a lot less. And we're trying to figure out how to work together as a group to help, to have all of the same and have equity amongst us. So, I mean, you couldn't be more right about that. The cost of life is very expensive for people in a certain sort of generation. Most people either have owned their homes and have been living in the same place for a long time. And so salary sort of the failure to have salary sort of follow inflation is almost less important, even though it still devalues the work, than these new people coming out of fellowship who are really needing to be able to pay their loans back, buy a home, and who can't afford any of that on what's actually being offered. This
Yeah.
is very apropos amongst it's the discussion now. So I'm
It
glad.
is.
Yeah,
We're at a crossroads, and yeah, I do think that we need to be agents of change because this can't be sustainable. And
I'm glad you brought that up. Nobody has actually talked about that specifically, so I think that's super.
mm, yeah.
Um, Shifting gears and talking specifically about SGS, you talked a little bit about it when you brought up your mentors and sponsors, but what has the society meant for you in your career?
Well, obviously, the reason why I go every year to SGS, it's very different from other societies. And let me tell you, I do go to a lot of meetings. Don't tell my chair, but I have, traditionally, and I'll be going to, OGS was here in December, and obviously I'm going to New Orleans for AHL, and, my partner, Andy Sokol, has been president of that. My partner, Rob Gutman, is now president of OGS, and I have been a past president of SGS. SGS is my favorite meeting because it is designed for surgeons, and issues that are related just to surgeons. And, if I am going to put my valuable time into something, it's to hone my craft. And so at these meetings, I get surgical tips and tricks. I get information on the best evidence with these systematic reviews. I get inspired by all the young investigators that are in the Fellows Pelvic Research Network and the core group. I mean, I see the future as being very bright. And I am just happy and really feel honored and privileged to have been a part of it in my own little way. But, I think that a lot of the courses that we've had, and the cadaver courses and the anatomy courses, the kind of work that's coming out on the PAG group with the pelvic anatomy group, I mean, it is unmatched. And when I look at what the future is in terms of having something like a repository where we can see surgical terms, I mean, the anatomical terms with the videos, and all of the images, courtesy from people like Dr. John Delancey, who is a true, Renaissance man, in my opinion. It's just really, really, really amazing.
What I love about it is that so many surgeons like you and a lot of the individuals I've interviewed for this project, the name of the society is Society of Gynecologic Surgeons, right? It's the society of these individuals, but so many people like you have also changed what you picture when you hear the word surgeon. I think SGS is really representative of sort of a lot of diversity in what it means to be a surgeon and what that looks like. And so I think that's why our society is so great,
Yeah, I mean, I'll just say, during my term, which is when the Dobbs decision came down, we were able to really partner with our colleagues from family planning and come up with some really interesting qualitative data about that impact of that decision on gynecologic surgeons training in the 42% of programs that are in restricted states, and what that means, and I mean, that's really important. And I think, I know the election is what it is, but there was a lot of this on state ballots, and I think, we still need to get involved. We can't just just think that we're powerless. Honestly, we have a lot of power. And I'm here in Washington, whatever. But I feel like they need to hear from experts like us about what it's like to be, as Brene Brown says, or Teddy Roosevelt, in the arena itself, and the kind of challenges that we're seeing in terms of coverage, you and your transgender work. I think there's getting, medical treatments covered for endometriosis, some of our incontinence meds, obviously hormone stuff. It's really important. And I think, we will continue to fight that fight, I think, here at the Society for Gynecologic Surgeons. and band together. The other one that was sexual harassment. You know, the first two people that came out with the sexual harassment issue and at the incident in ACOG was SGS and SGO. We got together and said, you know, this is something needs to be done about this. The prevalence is too high, you know, of harassment in a society, a specialty that takes care of women. So.
Well, there's no doubt that those saying stronger together, right? And so that's what at the core of what the mission of these society. I mean, you're speaking to something really important. Sure, these societies are about training and teaching, putting together research programs, but also this advocacy and this coming together in order to make that change, right? And this is going back to surgeons as change agents. As a society, there's a lot of ability to do that if it's done as a group, right? So representing the same mission. So
and educating ourselves onto the best ways to make that change happen. I think that that's really important. Also getting together with the American College of Surgeons, you know, when Carl Zimmerman was there and Patricia Turner came and said the House of Surgery stands together, and it's actually, you know, started with gynecologic surgery. I think that we need to remember that history.
Yeah, you're right. You're inspiring me, but I'm a fellow of the ACS, but I haven't participated in a lot. And I think I need to sort of become a little bit more active in the society. So I'm a fellow and I did everything I was supposed to be part of it, but I probably should be more active in it. Do you have a specific SGS memory that you can think of? I'm sure you have so many, but one that you want to share that there's a lot of after hours memories, but something that you
well, yeah, we want to be PC as always, you know, so many fun memories, but I think like from a scientific point of view, I can remember my presentation for membership was our VAMP study, which was the vaginal mesh for prolapse. It was native tissue versus honestly it was the Johnson vaginal mesh product, and we had halted that trial early on. And I remember presenting this, and I remember it just being extremely quiet after. And then I remember there was a very robust discussion, which obviously continued for many years. And a lot we've written a lot about that, and that has launched a lot of my partners' careers as well in terms of coming up with some multi-site studies on this, which, you know, I think that we were able to make some contributions and some changes. You know, maybe the pendulum will swing back and forth or whatever, but it is only when we work together to try and do this in a way with industry, you know, as a partner, but in an objective way that puts the outcomes, the functional outcomes for our patients at the forefront, that we can, you know, do the best job we can. So again, I just remember that as my membership presentation. But yeah, I have a lot of fond memories. There's just, you know, being able to meet people like Ray Lee, obviously like John Delancey, Tom Elkins. I mean, so many people that I've read about and admired and have presented at this society. It's kind of cool. Very approachable.
Somebody that I interviewed said, what's really great about the society is that all of these individuals that you've admired and that you read, you know, things that they've published, you know, you've never met them, but they're at arm's length and you can easily just come and tap them on the shoulder. And it's one of those places where people are happy to be introduced to new people and share ideas. And so those kinds of memories are really important too. You know, there's obviously all the fun ones, but sort of that memory of getting that opportunity, or the memory you mentioned is really important. That was a pivotal study. It also led to a lot of thinking about what does proficiency mean too when we are doing randomized trials.
Yeah.
You know what I mean? Like sometimes when we're comparing new things to something we've been doing for a long time, that new thing, you really need to be proficient in it before you actually study it, right? And so that I think that trial specifically actually was very, very important for so many reasons.
And then when you talk to people like Holly Richter and Becky Rogers, Vivian Sung, I mean, I mentioned these women because I think they're major powerhouses that have really, some of them probably have the highest what are those H factor or H scores? Um, and so humble and so humble, who give you good feedback and advice that now I can just call. Not even just about like how to do this trial or what would you suggest be the primary algorithm with questionnaire, blah, blah, blah. You fall in that category too, Cecile. But even some like personal, my things that happen in your personal life, your career, when you're raising your families, things that happen as you get older and you're in that sandwich between, sick parents and, trying to do things at work, and balancing it all out. I can just remember talking to Vivian because she's just so personal and real, and people sharing with me their own like things that have happened to them. And anyway, what I always remember is like how generous these people are, not just with their knowledge, but with their time. And when you talk to many of them, they're going to look you in the eye and they're going to really be listening, like with their open heart. That's very rare. A lot of people are just looking for what's the next thing or how can this person help me get into stuff. But these people, it just feels like people really care.
Agree. Couldn't agree more. Last question. Your
Yeah.
favorite surgical instrument and why?
My favorite surgical instrument, the lighted section irrigator. I can do or the Nazat Dorsey irrigator. Like, I can just do so much with that.
Whenever
and just pointing and it's a great little thing.
I'm going to tell you two. Well, one is a follow-up question. If that's the case, do you let anybody else hold it during your surgeries? If you're assisting, does anybody else get to hold it?
Maybe when you're on the left side and someone's operating on the right, but for the most
part. You are in excellent company. That is Deb Meyer's favorite instrument, and it is also Dee Fenner's favorite instrument.
Well, of course, yeah.
And what's so bizarre about these interviews is I'm going to be able to talk about everybody's favorite instruments, and I can't not remember them now. I'm now kind of obsessed with John Delancey's favorite instrument, Mark Walter's favorite instrument. So that's why it's been fun doing this.